Welcome to Soft Bites Podcast. Your life, your dentistry. We talk about ways to have more fun and meaning in one of the coolest and most rewarding professions in medicine. Conversations on how to bring awareness, create a healthy workplace, and provide emotional insights to make dentistry a fulfilling activity while making space for one's wonder, creativity, and freedom. Here are your hosts, Manuela and André.
Welcome everyone. Welcome to Soft Bites Podcast. This is episode number 12. Hi André, welcome.
Hey, a dozen episodes. How cool is that?
It's nice. It's already a big number.
More than 12 hours talking about dentistry. How boring can that be?
It's not. If you like it, it's not. Look, today
This is my weekly therapy. Where I talk to my shrink.
But not really. I think you are just putting. For me, it's kind of therapeutic to sometimes put everything that I think in a not very organized way in words. So I think it gives meaning and it gives sense to what's going on in our minds. I hope that it makes sense also for the ones listening. But we are having very good feedback. I just read you an email that I got today, and really think
people asking for extra dates for the course. Well, let's see.
Yeah. So today we are going to talk about, not only, but we're going to talk about money and why dentists don't like to talk about money.
Money.
First question.
That evil.
Do you think this is true? Do you think that dentists don't like to talk about money?
I'm 100% sure it is true for the vast majority of dentists, including me. Well, now I think that I overcame that, but yes, most dentists in the first decade of their careers, when, of course, we are talking about private dentistry, right? Because there's also hospital dentistry and social dentistry, which is a different category, right? Yeah, but it's true. I agree.
Yeah, my
actually, I'm remembering now. I had an associate when my practice now is I was actually 17 years. In the first, I would say in the 5th year or 6th year, it was my second associate. He was a dentist. He was working on occlusion. And then, my first two associates, the first associate and then the second associate, they both decided to finish medicine, to finish the medicine degree. And this second one, he was talking to me and he was saying, look, one of the things that frustrates me the most is having to place the money into the treatment decision equation. And it's true, it's frustrating because I think that when you get out of, when you do the degree, when you do the degree of dentistry, you still have a lot of the medical attitude, which, as we spoke in the last episode, it's great, right? I think it's the salvation of dentistry for the future, like I was telling you, because we have to treat patients and not customers. But what happens is that we still come out of dental school with that medical attitude, and it is especially when you want to practice dignifying dentistry. But what I mean by dignifying dentistry is something that you would do for your friends and for your family, which I don't think I don't see any other way of practicing dentistry. I mean, makes no sense if you are treating patients in a different way that you would treat your family. I mean, if you don't think it's that best interest. And I'm not talking about an elitistic treatment. I'm talking about basic hygiene, adequate time to communicate to the patient, to do a good clinical work. Um, and what happens is that it gets frustrating the first years of dentistry because you realize that money is interfering in the clinical decisions that you need to do. So it is like it's something that is bothering the decision, that is bothering your mental stability, even because you are basically diagnosing, you are explaining to the patient, look, you need to do a root canal treatment. And then ideally, for example, typical example, you need to do a root canal treatment. And then ideally, you should be doing uh, a crown. So, and that associate one of the reasons that he stopped doing, that he went to do the medicine degree is because he didn't want that the money had such an impact on his only daily decisions and stability. So, long story short, then he went to the Netherlands with a medicine degree, but now he still works as a dentist, which is quite funny because, and he says because because of the system of dental services there, money is not that much of an issue because there's the government pays some parts of the treatment. But that's just an example of someone that actually wanted to quit dentistry because especially when you work in private practice in a small town and you want to do quality work, you have to be mentally strong in order to still find the thrill of dentistry whilst you need to talk about money, and I understand that frustration. I think it's something that is really present in the first, I would say, the first decade of practicing dentistry at private practice.
So yeah, I was talking to someone that he is also a doctor, so but on orthopedics. And I was talking exactly about that, about how in dentistry, and this comes in a context because he needs a big rehabilitation, and it's so it's big values in dentistry, and big amounts. It's a big amount.
Let me guess. Sorry to interrupt. Let me guess. He says, okay, so you are asking me for 10, 15, 20,000 quid while I can replace a whole joint for a quarter of that money.
Well, no, not exactly. It was just maybe he was thinking that, but what he was saying to me is that yeah, we don't have that dentistry has that part. So because the dentistry has the part of discussing money, and he doesn't have to do that with his patients in the hospital. So
well, at least not to that degree. I mean, it's not a big deal there. It's not one of the it's not the elephant in the room. While in dentistry, it is a huge elephant in the room.
In private practice, it is. So that means that it's part of the job. So
dentistry, yes.
Yes, it's part of the job.
Yes, it's
but and according to what you said, and I think that is absolutely true. In the university, in schools, you are not prepared for that. So you are still. I mean, you are aware that it's a private practice, of course, but when you come out, you I think that you are not prepared to have these conversations with the patient. You are not prepared for the impact that actually money can have on your day, and that you are also, I think that it comes with time, not in a very long term, in a short term. It comes the awareness of, okay, I have to deal with this is part of
Hmm.
the job, because it is in dentistry, in private dentistry. You have you have to talk about money with your patients, because it has an impact on the treatment plan,
On the treatment
on the treatment
itself,
itself.
I'm going to give you some examples. For sure, yeah, I'm going to give you some examples of that. Yeah.
Hmm. Hmm.
For example, I think that I've talked to you about this. So one of the protocols, one of the operating principles that we have in the practice is that whenever the patient comes for the first appointment, um, and if he comes for initial examination, he knows what he's going to pay. So basically, when he contacts the practice, there are only two options. Either he has an issue and he wants to solve the issue. The issue can be, I want to do a cleaning, I want to do I have a broken tooth, I have pain. That's one. That's an issue. Number two is they want an opinion. So if they want an opinion, they are told, look, we are going to book an initial examination. This is going to cost this amount. We are going to do X-rays, which are going to cost this amount. So he knows what he's going to pay. But when he has a broken tooth or when he has some pain, we don't know if we are going to do a simple restoration. We don't know if we are going to just prescribe some antibiotics. We don't know if we are going to do a root canal treatment, which are completely different prices, right? So the patient comes to the practice, and we have this rule, which is they are never going to pay more than 70 or 80 euros for the first appointment. If the treatment that they need requires something higher than that, the doctor needs to be able to tell them before they start. Let me give you an example. The patient comes in for first time, never went to the practice for a root canal treatment. We charge in Spin, a small town, we charge more than 200 euros for a root canal treatment, which is more than fair because root canal endodontics is expensive. There's lots of time and materials involved, plus the restoration, which is a big always a cusp coverage restoration that can be either direct, that's the minimum,
Hmm.
or indirect, which is the ideal a crown. So if we really want to be completely honest and transparent with the patient, we have to tell them, look, you have an issue that you need to solve. We have to do root canal treatment. This is not going to be finished today. You have to come for a second appointment. But I don't want I want to be transparent with the patient. And we need to tell them, look, the total cost of the root canal treatment is 20 euros plus 70 or 80 of the restoration, which is the minimum that we should do because ideally we should even do a crown. Now, we don't talk about the value of the crown, but we do talk about the value of the root canal treatment. So you want to proceed. I think this is important because this is honest with the patient. And if we believe they have some other dentists or if they believe it's expensive, because for my town it is an expensive treatment. Many dentists they charge like less than half of that. um, we have to make the patient at ease and tell them, look, we can do the first session here and you can even finish it because you are in pain. You have to do something and you can even go and finish this elsewhere. So this communication, the whole team, especially the guy that does endo and also the general dentist that does the first sessions or the emergency, the first sessions of the endo, they need to be able to have this conversation, and it is mandatory. You have to be able to do that. So you have to desensitize yourself about talking about money. And the trick that I found for that, because this comes more natural to some patients and less natural, more natural to some dentists than the others. What I found is that there's a trick, in my opinion, which is you should never, you should always have a conversation where you will always except if they if they don't want to pay that amount of money. That's the same when you present a 10,000, 15,000, 20,000 treatment plan. So you need to be able to talk about money in a completely honest and transparent way. You have to be completely open in such a way that if the answer is, oh, that's very expensive, you also have to keep with the same energy and say, well, I wouldn't say it's expensive, but we understand it's a high amount of money because but it is a high amount of money because we have a lot of expenses and we give guarantees. So you have to say, you have to all have all these answers on the tip of your tongue, right? But you should never take it personal if they say it's expensive, if they say they can do it, and you should always place them at ease. For the root canal treatment, say, well, if you want, we can do only the first session. We will charge you, or I can do just an emergency treatment. We'll charge you like 70 or 80 euros, and you'll go and finish it elsewhere. But show that you have, show that you are on their side. You are not there. So money is an important detail, but the most important thing is that they feel comfortable and they feel at ease. If you see in my website, let me actually read it for you to understand more or less this philosophy. Let me go to the English version of my website. And basically we have something that we call concept. So what's our concept? So what's our values? What do we stand for? So we have here the English part. So we go to clinic and just a bit. But basically, in our website and even in the welcome pack, when they get in the clinic, what they see is and what they read is that but basically it says that communicating transparently is the most important part of our job. Okay, that's the most important part of our job. And this way, and we say that we always take our time to the diagnosis, and we always take our time to present you a treatment plan and explain you so that the patient can, without a hurry, make his or make their own decisions without any pressure. And I think this is really important. So in my opinion, I think that you should make the patient understand that they have their decision in their hands, at least for me. And I understand that this may not be the trending stuff now, right? Because I think that
What do you think is the trending stuff now? Cell?
So let me just read one of the concepts. So the concepts are clear communication, dedicated dental implants, and then using latest technologies, decisions with experience and scientific evidence, minimally invasive treatments, interdisciplinary team, focus on prevention, safety, hygiene, and privacy. Okay, but the number one is clear communication. So what do we see? What we say here? The most important part of our work, I'm just reading, is to listen to your concerns and communicate in an accurate way. Information about success, risk, and maintenance of each treatment is important to make the right choices. The patients can evaluate this way, patients can evaluate without pressure. Their decisions are always respected. Okay? So I think having for them understand that it's okay if they don't accept our treatment plans. And it's okay if they don't accept the money proposal that we give to them. And I think that this helps dentists to still feel like humans when they are talking about money. I don't know if this makes sense to you.
It makes total sense. But I wanted to you said this is not the trend right now. What do you think is the trend? Is selling? Because I think that this is the trend right now. What you said, because according to the last, I think so. Because according to the last studies on on patient research. So what does a patient want when he goes to an appointment? According to the
Mm,
last studies, so this doctor-patient relationship is changing. The relationship
mhm.
where the doctor was God, right, and the patient didn't question the decisions or the treatment plan. That relationship doesn't exist anymore. I mean, maybe it still exists, but it's not. Nowadays, patients want to be heard. They want to feel that they are part of the decision. They want to have a word on the decision. You can see that now in the
They need to.
vaccination. People wanted to have the right of
Yes,
choice. You could
yes,
see that. That
of
was
course,
very obvious.
of course.
So I think that's the trend now. I think, and that's exactly what you described. That you say, okay, clear communication is one of our values. Good communication is one of our values. We want to have clear communication with you, and due to that, you are going to be free to make your choices. So I think that's the trend.
Yes,
But
yes,
you were saying that
yes.
you don't think that's a trend because what's then selling?
I, I think there's I think it's not only in dentistry, but this is the feeling that I have is that um, dentistry is unfortunately for many colleagues a way of making money, and it's not. It should not be that way. Dentistry is a medical specialty. That's the way I see it, and and I think that I've been exposed to many different kinds of dentists and many different kinds of realities, and I understand what goes. At least I have my opinion of what goes in their head and the level of authenticity and the level of mental sanity that they go through. And I don't believe that the selling mentality will make you a happy person in the long term. That's what I think.
Hmm.
I think it's a trap. I think it's a huge trap. I remember a conversation that I had many years ago, and I didn't quite understand what the guy was saying. Basically, it was some colleague of mine when I started to thinking about working in London, and he was working in London already. And he told me something that I never forget, but I was completely speechless. So basically, it was something about how much should I charge or how much I should not charge. And then he told me, look, if you don't do that, he basically was giving an advice. He said, if you don't do this, you'll never get a Porsche. And I asked him, what Porsche? I was really clueless about what he was talking about. But then I realized, and I started to talk to people, there's a lot of um, the the making money in dentistry and in medicine as well. There's this but that you need to make money. You need to make, and I think money is very important. I think money you should be fairly paid for what you do. But when you treat people, you have a responsibility. You need to you need to you need to bring something more to the table because you need to be their interest is above everything else. That's why they call you a doctor. That's why they call you a physician. That's why they call you a health practitioner. I mean, because otherwise, because what happens, it starts to be completely perverse. It's dangerous.
Hmm.
It's and it's not. And I think that when I say it's dangerous, people believe it. Oh, it's dangerous for the patient. Of course, it's dangerous for the patient. We see that every week. We see the atrocities of the fast, easy, and cheap treatments every week in every country. I think that
Hmm.
any responsible dentist sees that complete atrocities, which is by itself are really bad. But it's not what I'm talking about. I'm talking about the mental sanity of dentists. I don't think you can be. You can be. I think that looking back, when you have that sort of mentality in dentistry, when you look back after a few decades, you will be completely burned. Maybe not burned in terms of working too much, but ethically burn because otherwise if you get yourself if you believe that your success is the financial part. I think that's addictive,
Hmm. Hmm.
and and I think that you you need to find masks. You need to find masks, and I see that a lot. I see many people that the way that they market, they have nothing to do with what they do, which is they even market honesty. I understand it's not, it's completely opposite of that, and I see that a lot. And I know it's not a funny thing to talk about, but I think we need to talk about this. I mean, people need to be ashamed of themselves sometimes. I mean, I don't think that I could. Also, because I'm so exposed, because I give so much courses and I get so much referred patients, I could never do something that is the complete opposite of what I teach, of what I show on social media. I mean, for me, saying something on social media and then being the opposite person in the practice, I don't think it makes sense. And I see a lot of unhappiness in people because of that, because they think they need to create this persona, this marketing, this thing that they need to then keep
Feeding.
keep feeding, and it is in a big part because of the financial pressure of that. So I think that the biggest interest should always, when you talk about money, should always be the
Valuation.
patient's
Yeah.
interest. And this means that the path is probably slower, the progress is slower, because you will have patients that are referred by other patients, mouth to mouth, not so much about marketing. So you need to be, if you believe and if you think that you are a person where ethics is important, and I mean, if you want to look yourself in the mirror in a few years and think that you help some people, I think that you need to be as much transparent with money as possible. It may make your progress slower, but then on the other hand, we also have to respect people that believe that the money is the paramount part of dentistry. um, and I hear that a lot. For example, I have many students that work in many practices, and I know what happens. I know what happens, and I know how they market. I know how they show themselves, and actually what happens in reality. And I get this comment more and more, which is they only see
Hmm.
numbers.
Hmm.
They only see numbers. They only see money. They only see numbers. They don't care about the patient. They only see numbers. They treat this as numbers. And I can tell, I hear this a lot. I hear this a lot. And it's of course, I know it's not something that is funny to talk in the podcast, but it's the reality. And I think we need to have the courage to talk about things as they are, because at least it may people that have um, power in their decisions to be able to think twice. To look, we are treating people here. This is some people here are investing their life saving in this treatment. Um, if if we are doing something that we believe that will not be that will have a negative impact on the patient in the short term, we should not do it. I mean, I'm not talking about doing like an amazing job. I'm talking about doing something that you would accept in a human's mouth. That's what I'm talking about.
Hmm.
And you have this needs to be placed on the table. I mean, I think people need to talk about this. And this is why the money issue has this
Hmm.
perverse effect, which is okay. Don't want to charge that much, but I need to compromise on the quality, on the safety, and on the long term success of the treatment. Sometimes not the short term. When you talk about implants, sometimes it's a long term. I mean, but that person could be your mother, that person could be your father. I mean, are you capable of doing that?
Hmm.
And I think this is also a big source of frustration for dentists, especially when someone else is deciding for them. So yes, they are afraid of talking about money on one hand, but also they do have a lot of limitations in terms of what they can do sometimes.
Hmm. Before we I have a couple of questions and reflections here, but I wanted just to ask you this as a provocation about what you were saying, and going back to the beginning when when I was saying that you don't teach you about money in the university, and only when you get out
Yes,
you see that it's part of the
yes,
job. So you have
yes,
to talk about money. It's part of the job. So do you think that
yes.
that means that if you are a good seller, you're going to be successful
Of
as a
course,
dentist? So it
you are going
equals.
to be at least. I think that communication can mask technique. Good communication skill can certainly mask, at least in the short term, can certainly mask, and sometimes even in the long term, but can certainly mask poor technical skills and poor ethics. I'm going to repeat that again. I'm absolutely sure that good communication and sales skills will mask in the short term, and sometimes even in the medium and long term, will mask poor technical skills um, and even poor ethical
Mm-hmm,
values. I I have to say that, and I have to. I think that most dentists they know this,
mm-hmm,
and it is what it is, right? And at the end of the day, it's you that has to make a decision on how you have to live your life. Um, Also, it depends on the. In some countries, the governments they are actually um, they have implemented rules and protocols to prevent some to have some decency in the profession. Some other countries, like Portugal, we don't have that. We do not have decency in the profession, and that's something that we should not be afraid of saying. We do not have decency in the profession because the amount of completely unreal prices of insurances that pay the dentist or pay the practice an amount of money that is not even enough to pay
the material.
the sterilization and no
Yeah.
no I don't even
Yeah.
reach the material, the
Mm-hmm,
hygiene.
mm-hmm,
So if an insurance does not give enough money to pay the hygiene, it's legitimate that I believe that that sort of insurance is putting in danger the patient.
mm-hmm. Yeah.
I have legitimacy to think that. Unfortunately, due to many interests and lack of courage of our representatives, we do not have. And but it's normal. It's leadership in Portugal is especially in the political area in political stages. It's very weak. They
Mm-hmm,
are very concerned of what other people think, and the courage is very low. And but this is in Portugal, right? Other countries is
mm-hmm,
different. Portugal, Spain, I think it also happens the same. Italy also happens the same. But for countries where politicians are more um, and leadership is more serious, let's say, I don't see that happening as much because there's a control there. But I and the reason why I think about this is because this is really serious. This is really serious stuff. People don't like to talk about, but this is placing some patients' lives. I would say lives, but health in
mm-hmm,
danger.
mm-hmm,
You know,
mm-hmm,
so so dentists they have this. Okay, I'm working in a practice where they accept insurances that they pay them less than what it would be normal to have things cleaned and sterilized. So what am I going to do? Am I going to accept this? And most of them they accept this. They need to sometimes to trick the system to say that they are doing things that they haven't done. Number one, to work on quantity rather than
mm-hmm,
quality, and to make the financial gains a priority,
mm-hmm,
right? And sometimes that happens because they don't feel comfortable about talking about money
mm-hmm,
in completely private practice. I don't know if it makes sense to you, but basically, completely private practice you need to talk about the money much more often, and the money has a much
Yeah.
bigger weight on the treatment decision than if you work in private practice and if you work with an insurance.
Yeah. Before we get to how we can get comfortable to talk about money, because in the beginning you said I used to have that problem and now I don't feel that way. So you can get comfortable talking about money. Before we get to
I
that, let me just ask you something. Do you think that one of the reasons why dentists also don't like to talk about money, it's because patients still are not still are not or informed enough or don't value their
mm,
oral health
mm,
enough still? So do you think it's still because it's something that patients are always doubting of the
yes,
value, so
also.
that
Hmm.
or of the impact that's going to
Yes,
have in their lives? So it's something, the oral
yes.
health, it's something that it's still secondary and
Neglected.
neglected
Yeah,
for
I
people. So
agree.
do you think that's one of the reasons also, because it's
Yeah,
emotional? So you're already
yeah.
doing an emotional treatment, so like that some people have anxiety, etc., etc.,
Hmm.
and then you also bring money to the table, that it's something that's
So
also
what you are
emotional.
asking is that one of the reasons that they are afraid of talking about money is because the patient will find it. They believe that in most situations the patients will find it
Yeah,
expensive, right?
it's something that
That's basically what.
whatever money
Yeah,
you ask, they
it's
always
going to be expensive
find it
always,
expensive.
always.
Mm-hmm,
Yes,
mm-hmm,
also,
mm-hmm,
it's also. So what is he going to think of me? He's going to think I'm robbing him,
mm-hmm,
and yes,
mm-hmm,
that's also one of the reasons. Like I told you, one of the tricks to overcome that is be completely open about that and let them decide. So there's no pressure to sell, because in some practices, unfortunately, there's pressure to sell. But so there's no pressure to sell. Just inform. Focus on the process, not on the outcome. Focus on the process of communication, not on the outcome, if the patient is going to accept or not. That's number one. Number two is to be really aware of the money involved in these situations. For example, if I know that doing an implant, the way that we practice it, is going to cost me X, I'm not going to feel bad about asking for Z, because I know this is what the implant is costing me, fixed cost and variable cost, number of assistants, number of hours. If I know
mm-hmm,
that on a regular basis, like we talked, we talked before, and we'll talk about this in the course as well. If I have a frequent information that comes to me that tells me how much I am spending and how much does an implant in fixed costs and variable costs is costing me, I will have less anxiety when I talk to the patient, because I understand that there is a
mm-hmm,
cost
mm-hmm.
there, and it is very important that you have, like I said, in the tip of your tongue, very quick
That, yeah.
answers to objections of the
Mm-hmm,
patient, like this is too expensive. Said no, this is not expensive. This is a high amount of money, but this is because we give guarantees, we work with good materials, we take our time, we are serious people, and we are here for the long
mm-hmm,
term. And I understand that some people, you may find some people that do it cheaper or much cheaper. And we understand if you prefer to do that, but I am not, I am here in your best interest. And this is the
mm-hmm.
amount that we need to charge for that. And there's also something that I used a lot especially when I see that the patient is really, I said, look, I'm not here to sell you
Mm-hmm.
anything. This
Mm-hmm.
is this is a phrase that we use
Mm-hmm.
often in my practice. Look, I'm not here to sell you anything. I'm here to
Mm-hmm.
inform
Mm-hmm.
you. Okay, either you do it or you don't do it. Um, it's not the most important thing for me. The most important thing for me at this point in time is that you understand three things. Number one, this is what is happening to you. This is what will happen if you do not do anything. And number three, this is what you propose you, and this is the cost. This is, at this point, this is for me the most important thing, is that you completely understand what we are talking about. I don't want you to make any decision right now. I want you to go home and eventually even
Yeah.
ask for some other opinions. And then, if you want, we'll be here. But I am not here to sell you anything.
Hmm.
I'm here to inform you.
And to.
Okay. And that is a completely
Hmm.
winner
Hmm.
winner
Hmm.
conversation, because you are placing yourself in, you are letting them know that, number one, this is what you think it's fair, and they don't have to do it.
Hmm.
You just want the best
Hmm.
for them, and this is a pattern of conversation that we often have with our patients. So, and I think it helps because I think that the associates in my practice, they understand that they have no pressure
Hmm.
to sell anything
Hmm. Hmm.
whatsoever. They only have the pressure to treat the patients well and to inform them and to assist them in whatever the decision that is. And if they want to go something else, we are delighted to send the other colleague or wherever they want the X-rays that they have done, the treatment plan that they have done,
Hmm.
etc. So we are not focused on the outcome. We are always focused on the process.
Yeah. So let's go, and you already entered it on it, or how you can make this something
Comes
that comes
natural.
natural. You don't have, I mean, that's part of the job, but that comes in a natural way, so that you don't have that feeling that you don't like to do it, because you will have to do it. So how can you do it in a way that comes natural, and that you
So
feel? I think that it has to do a lot with what you said.
mm,
It has to do a lot with, you're not selling. You are not selling. You are informing the patient.
this
Uh,
yeah, these patterns that I use, they have to do a lot with the way that I see life itself, and there's a lot of me in there, and I don't think that everybody needs to use this. It's almost like a radical approach. It's like, look, I'm not selling you anything,
mhm,
just information. It's not in a rude way. I'm just, it's not as it sounds when I'm talking to you. It's a much more
mhm,
compassionate and empathic way. It's like, yes, I understand this, but look, you have to understand, like, I am not here to pressure you or selling you anything. My job here is your best interest, which is information. I completely understand if you want to go elsewhere. We are the first that will advise you that. So let me answer that in two ways. First, what happened to me, number one, and number two, what would be the advice that I would give to my younger self in the first when I started to be uncomfortable talking about money. So what happened to me? It was difficult. There was a lot of anxiety. There was a lot of internal, how do you call it,
mhm,
turmoil,
mhm,
right? It was very difficult because you have to remember that I opened a practice in my hometown. So many people that knew me since we were little, and I didn't when I was very young. I didn't have that much of a privileged life. My fathers, both of them, they work quite a lot. We are from very humble families, and as we moved on, what is this guy that's opened a practice and we came here because we know him since he was very little? Why is he asking me for thousands of euros for treatment? Is he getting rich? Is not the Andrew that we used to know, and that caused a lot of emotional turmoil, um, and it still causes. It still causes, not in the way it used, but sometimes I still feel that. But I realized that I had two options there, and the options were, okay, I'm going to do um, whole filling dentistry for the rest of my life, and I'm just going to have a practice that does just social dentistry, the same price. We have people that do most of the things, and we'll just do operative dentistry, endodontics, prevention, which is fine, which is very good. And I would eventually delegate the more complex treatment. But the thing is that I always wanted to do complex work. I always wanted difficult stuff. I always wanted interdisciplinary difficult stuff. So I had to say, look, I cannot allow what other people think of me determine what I'm going to do in my profession. And I'm going to be honest with them. And if they don't accept this, I will understand that, and I cannot mix my friendship with that, or my social relationship to those patients and people that know me. I cannot mix that with my profession, because those are two different things. And that slowly helped me realize, look, it's either me or them that's going to be unhappy. And they always have the choice of going elsewhere and still might be my friends. And I had to make that choice. Otherwise, I would be miserable. Otherwise, I would be not be able to work with good labs, not be able to do good communication, not be able to be in a position where I can be of a positive influence for other dentists. I will never be able to do that. And even still today, I was talking to my orthodontist, and we were talking. And I was like, damn, the amount of treatment plans that we give. I mean, we don't do simple treatment plans in my practice. Most of the people that come to us, they sometimes they are not looking for expensive treatments, but they get out with treatment plans of 5, 10, 15, 20,000. And it's sometimes they had no idea that they were about to be presented that. One detail which is very important, we always talk about the overall price in the first appointment, what we believe. Look, we are talking maybe 10,000, 15,000. This is an expensive. Do you want to know more details? And said, well, yes, I want. If they don't know, that's completely out of the question. Okay, so we don't move. We don't want to have a patient there that thinks that's going to cost like 500 euros. No, we presenting them at 20,000 euros treatment plan. So we don't want that. Um, so that's what happened to me, and it is still difficult. But what I realize is that if people see me like that, they don't know me, and it's part of the game to lose some friends in the process. Some friends, but not some friends. It's you can never please anyone. If I wanted to please everybody, I would probably, like Steve Jobs says, you have to go and sell ice creams. So there's a personal development there, and I think that's in every profession where you have some entrepreneurship thing. You have to, like, for example, in you, Manuela, how many people, when you started this mindful journey, I'm sure that you went through had what are my old colleagues going to think of this? So you have to overcome that. It's either you or them. So yes, there was some internal work, and I had to choose. It's either me or them, or the patients. Number two, which is, what advice would I give to my younger self when I felt those turmoils in the first? The advice that I would give is the same thing that I talked about, which is, you are not selling anything. You are informing them. You are just telling them the truth. This is the reality. If you want something decent in your mouth, this is what it's going to cost. What is something decent? Something that will not trap food. Something that will eventually not have problems in the future, or will try not to have problems in the future. Something that is clean. Something that is honest. Something that it doesn't have to be elitistic, like I always say. It doesn't have to be luxury. It just has to be decent and honest, and and delivered by an honest team. That's what I mean. My practice, it's true that the treatment plans are quite high, but it's not an elitistic practice at all. We treat every sort of patients, but we try to be as transparent as possible with them, and we try to be as honest with them. What goes right and what goes wrong, and what goes wrong, we are here to fix it, because some things go wrong, of course. Even in social media they don't, right? But in real life they do go wrong sometimes, and you have to be there and look. Sometimes it's not your fault. Look, we lost this implant, but we are here to fix this, and this may happen. Let's see why this happened, and we are here to fix it. So yes, the answer to that is what happened to me is that I had to overcome the fear of what people would think of me, number one. And number two, my advice would be, look, always remember that you can always tell them that you are not selling something, and you do not have the pressure to sell. So this is the concept of your practice. Grab to it. Never forget about that value. You are here to inform. You are not here to sell. And if you go inside the treatment room with that treatment plan, with that thing inside your heart, I think that everything becomes easy and the patients feel that. And do not expect them to accept things. Do not expect them to make a decision. And again, this is completely different from the corporate things that I see in dentistry, where they make like marketing expert. They close the patient inside the room and they just want to make the finance of the treatment in the same day, which I think is completely criminal.
Mm-hmm.
I think it's completely criminal. But again, yes,
Well,
those things only exist because other people allow them to exist.
The marketing part, I don't know. I'm aware that that nowadays corporate practices, they have the what's the name, that they have a name. I don't know the name in English.
Treatment
or
coordinator
patient
or
coordinator,
patient coordinator.
Yeah.
Yes.
But
yes.
But that part, like I told you, I don't know how that works. But I think that one.
Yeah. Sorry, Manuela. The reason I'm telling you this is because I hear every week. I hear stories, incredible stories about things that you could never imagine. Sometimes in practice that you think they are top notch in Portugal, and it is it's for these young people that tell me this. I really feel their pain because who can they trust? If someone markets honesty and they are completely the opposite, or if they work in a practice where they need to give a treatment plan between appointments, or they need to sell it in the same day, the patient needs to accept same day finance. I mean, and I think these are the stories that I hear like every week.
But what I was going to tell you is that in taking this to how you can overcome this difficulty on talking about money. I think it has a lot to do also with you having the awareness that that is something that you don't like to do or that you don't appreciate to do. So maybe that's a trigger for some of the colleagues. So if you have that awareness, because I mean, let's face it, once you start working, there are certain things that they are routine, they are repetition. So you can build like a paper with the most common questions that you have, and you can build answers. Just like you said, for some answers for some questions I have the answer in the tip of my tongue, and that's a good advice. I think that's very good advice. If you have, just pay attention to your body sensations and to your thoughts whenever you have to deliver or to talk about money, especially with higher prices. And if that's something that you see that it's giving you like body tension and constrictions and bad thoughts, you can really take note of the most common questions that you have to answer. You can build even a script, because I mean there are some of us that the communication skills, they like more to the treatment inside of the patient's mouth and not really the communication part. Can even write a script, an easy thing. And nowadays we have access to all this technology, pictures, and it doesn't have to be anything fancy, but but if you can have visual aid already prepared also when you have to talk about money, so to answer some questions. So I think that you can prepare yourself. And again, this has a lot to do with stress reduction. If stress reduction in dentistry has a lot to do with you anticipating things, and with you being able to give a response and not a reaction. So if you prepare this kind of questions, because like I said, I mean, it at a certain moment it's routine, right? So if you prepare certain a way, a script, and I know it sounds boring, but but it works.
No,
it really works. And
No, you have to
yeah,
do
and
that.
also if you are in a position that you reach the conclusion that you don't like to talk money, and if you are, and you can even reach the conclusion that you are not good at it. I mean, you can train
Mhm.
someone to do it. Maybe, I don't know.
Well, that's a very interesting question, and I also do not have the answer for that. Should you talk about money, or should someone else talk about the money? I believe that the doctor should talk about the money, because if I was a patient, I
Mm-hmm,
wouldn't
mm-hmm,
like
mm-hmm,
that. Okay, so the difficult part, I'm just gonna not going to low down to your level to talk about money.
mm-hmm,
This is my thought, but many people, many experts in the field believe the exactly opposite, which is in the States, for and also this is also culture, because in the States, dentists don't talk about money. It's a treatment coordinator that talks, so it's something normal. They don't want to mix the medical part with the money part. They just want
mm-hmm.
to be neutral regarding that. So there's a lot of cultural thing on that. So it really depends on what you think is ethically best. For me, I want my associates to be able to talk about money.
Mm-hmm.
Okay. Now, and of course I have financial interest in this, because Make Me Clear I developed a few years ago, and that was one of the reasons. One of the reasons for Make Me Clear is that you have be an expert, not a salesman. So what does this mean? Basically, you can easily create an elegant treatment plan that talks about money, but also justifies everything and the money by a professional document that creates the diagnose and creates a treatment plan in a very elegant and professional way. So the principle behind is this, and again, you don't need to use Make Me Clear. You can use whatever you want. But if you are thinking about presenting a treatment plan that is above, I would say 3, 4, 5,000, that will demand a significant amount of from the patient, you cannot just have it like a very unprofessional list of items with a total in the end. You need to be able to. It's like the same thing. Okay, so if the patient is going to make a good investment, she's going to buy a car, or she's going to buy a home or whatever, there needs to be a brochure. There needs to be effort from the seller. They need to understand that. So basically, the price of the price of the product or of the service is also reflected in the way that it is presented.
Mm-hmm.
Okay, in a certain way, it's marketing, indirect market, but it's also marketing, which is okay. I'm going to give a 20,000 treatment plan, but I'm going to create a document that is up to that
Mm-hmm.
expectation. So I'm going to explain everything, whatever we are going to use, what was diagnosed, what is the sequence of treatment. If there are stages of treatment, we are going to divide. We are going to talk about the we are going to talk about everything that we are going to do in a very elegant, simplified, and professional way. Okay, and this is one of the reasons why Make Me Clear was developed. But you don't need to use Make Me Clear. You just need to be able to create a template that you can use and that you can adapt. Yes, it's work that you have to do. But if no one is going to give you 20,000 euros if they don't believe in you and they don't trust you, so you have to make your homework. You have to be able to create documents that can be compelling, that they, okay, I'm going to ask 20,000, but yes, there's a lot of homework here. These guys, they did their homework, and yes, I may not have the money, but these guys, they know what they're talking about.
Mm-hmm.
So also Make Me Clear was also something that would complement in more comprehensive
Mm-hmm.
dentistry, more complex
Mm-hmm.
dentistry. So that was certainly money was also one of the factors why Make Me Clear
Mm-hmm. Mm-hmm.
was because we are talking about private dentistry. That was one of the main factors for
Mm-hmm.
that.
Yeah, I think it's one of the ways it's to really prepare yourself. And
Of
once you do
course,
the work, once you have the templates, a
yes.
template, like you said, it doesn't have to be Make Me Clear, but once you develop like a template that you can use so that it makes your
Hmm.
work easy, also
Hmm.
that you don't
Hmm.
waste
Hmm.
much
Hmm.
time doing it, then it's easier. The same way with the questions, the same way with and also having time. I think that for
Yes.
this, if talking about money is emotional, either for you and for the patient, even if you don't notice, it is emotional. So
Absolutely.
you should have time. It should not be in a hurry. I mean, and treatment
Yeah.
plans should be studied. When you deliver something, it's like for you not to have that feeling that you are selling, but that you are informing. You really did your homework, like you said. So you know that you are delivering the best option, the best treatment option for your
Yeah.
patient. And the also the second best option, I think, in this is something that I also know that you
Yeah.
advise,
Options. Yeah.
so that the patient should have more than one
One option.
option.
Yeah.
And I think if you have a good treatment plan that you studied and that you constructed, if you have time to do it, also not between appointments, and then if you have
Yeah.
time for the appointment, yeah,
Presentation. Yeah.
to present
Yes.
to give a
Yeah.
presentation, and if you have time
Yeah.
to answer the questions
Yes.
of the patient, because
Yes.
sometimes the questions say a lot about the insecurity and the fears, and there are normal, right? There are normal
Hmm.
about a procedure, and it's like you said, it's never personal. It's never personal. Even if a person has a lot of questions in the beginning, you should be able to give an answer. Of course, we are talking about normal cases. We are not talking about unreasonable questions. But then you obviously, with experience, you start to different to make the distinction. But I think that all of this makes talking about money,
Stressful.
yeah. So uh, but again, I share your point of view. I share that it, lots part of the stress can be reduced if you feel that you are not selling something, that you feel that you don't have that weight on and pressure of selling
Yeah.
something, that you are
Yeah.
informing, that the patient feels that there's a clear channel of communication, that you have the time, that you are there to answer any questions, that you are there to that you all
To
to
help
help
them.
them. And of course you you should also be able to deliver. That's a very
Of
important
course.
part.
Of
I
course.
think that for talking about money, that's actually a very important part, because if imagine uh, talking about money with someone about something that you are not sure that you are able to deliver, that's stressful. That's
Yes.
another, it's more one emotion on top of that. So I think it's and that has to do with another subject, that has to do with you doing the dentistry that you like. Just like you said, you knew that you wanted to do big treatments, big rehabilitations, that's what you are doing. So I believe that you should
Hmm.
find your space in dentistry and really do what you like to do, what makes what gives you joy, right? So if you don't like to see children, but you are seeing children every
Don't.
day, then you are not
Don't.
going to be happy. Yeah, don't see them.
Yeah.
So I think that if you let's go to the endo example again. If you like endos, just be the best endodontist, and you never have to sell treatment plans again. Yeah.
Yes.
So dentists don't like to talk about money, but it can be something that
That can be learned. Yes.
Yeah.
Yes. And can be overcome. That stress and that frustration can certainly be overcome.
And it has to be, just like you said, it has to be normalized, and it has to be something that I, I mean, for me, I have to say that if I'm and I remember that if I was doing a treatment that I knew that everything was talked about money, that I didn't had to, that the patient was informed,
Mm-hmm.
it was completely different. So I
Mm-hmm.
think that it's something that really, for the colleagues that are listening, that everyone should really take a look if that's a stress factor in their dentistry practice. If that's a trigger, it's like we already talked about triggers, and discover your triggers. What triggers you during your work day, and talking about money might be one of those triggers. So if you have that awareness, then you can come up with ways to make that relation with money and talking about money a little bit more a little bit less stressful, and it can even be something that starts to be a normal thing for you to do it. And one of the things, just like we
Mm-hmm.
said, it's pay attention to the questions. Pay attention on how you feel. Make note of the questions that your patients make. Find a way of presenting the treatment plans whenever you have to talk about money. And another suggestion that I was thinking when we were talking about patients, and because patients don't value the oral health, and that's maybe why they also don't like to talk about money. It's to educate your patients. I mean, when I say educate your patients, is invest in prevention.
Prevention.
Yeah, that's it. Invest
Yeah.
in prevention. Educate
Of
your
course.
patients.
Of course.
You even
Yes, I completely agree with you. I think the cheapest way to take care of your mouth is follow your dentist's instructions in terms of hygiene and in terms of hygiene and maintenance appointments. And I think it's really, and I think you touch a very important issue, because they have to understand that if they go through the preventive situations, they will save a lot of money.
Yeah, you know that in Belgium they have this system, because in Belgium everyone has to have insurance, and
Hmm.
but basically you have like 2 or 3 insurances. You don't have like 20 different insurances, and the prices are all the same. And they have this system that I mean, there is already the network with the in the practice. So whenever the patient goes to the practice, the treatment code is immediately on the system. And then after, so they pay the total amount at the practice, and then after 48 hours they are reimbursed in their account. Around 70% uh, the insurance pays. But
Hmm.
if they don't go 1 year to the hygiene control, they don't get the
Hmm.
70%. They get only 50% of reimbursement from the treatments. If they miss 2
Hmm.
years of control, then they don't get 50%, they get 25%.
It's,
Right? So
that is in Belgium,
that's in
right?
Belgium, yes. So that's a way of, they say
Of,
okay, you have to take care of yourself. You have to do the prevention. Otherwise, we don't give you the
yeah,
70%, because you are not taking
yeah.
care of your teeth. So
Mhm.
so that's a way of also for the patient to understand that they need the prevention, and that they need to go every year and to see and to do the cleaning. So I think that's important also to educate our patients and to invest in prevention.
Mhm. Prevention, of course.
Okay, something else that you want to say?
I think we touched very important points, direct and indirect, regarding to the thing of making of dentists being uncomfortable talking about money. I think that we talked about making sure that you are focusing on information and not selling anything, and also being aware that dentistry has high costs, and you are not robbing the patient, you are telling them the truth. Also making them at ease to choose other uh, some other colleagues and some other practices, but also in all the implications that that money has in terms of the in terms of the safety of treatment for the patients. And it's very difficult to treat patients when you compromise on the quality because you do not have the financial freedom to do what is the best, or because there's an insurance involved, or because of whatever. And and I think that you have to, okay, are you going to be unhappy by providing treatments that you don't think is the best for the patient just because you want to lower the prices, or you're going to raise to the challenge and tell them the truth, and do the dentistry that you believe is the most honest dentistry for you. And there's nothing wrong about making money, as long as it is in a fair way and in an honest way, and if the patient's interest is central to the whole process.
Hmm. Yeah, I totally agree with you. I totally agree with you. Okay, so I think we say goodbye for now.
Yes.
Thank you for listening. Thank you for listening to us. If you have any questions, any suggestions, any comments, just feel free to reach out. And we're going to have our course next week. We maybe we talk about that on an
Yes, we
episode.
should. Yes.
Um,
Mhm.
and thank you to everyone listening. And if you want to know more about us, about our course, just go to softbites.online. Every information is there.
Yes.
And we'll see you on the next episode. Thank you, André.
Thank you, Manuela, and see you in the next episode. Bye
Bye.
bye.